There we go. Hello and welcome to the Rise Up with Orion podcast. Thank you so much for joining us for our third episode in our 2023 series about diabetes prevention. This is a topic that is near to dear to my heart, not only for myself, but also my family and some clients that I work with as well. I do want to welcome our CDC certified diabetes coaches back to the webinar for this third episode. Megan, again, I've done these intros before, but Megan has graduated from Utah State University in exercise science. She's been an Orion coach for 10 years. I believe it's even more than that now, and is a certified personal trainer. She believes that health and wellness is not a one-size-fits-all journey and enjoys working with her clients to uncover the best practices for the individual. And we'll be talking about sleep today, so she can add that to her plethora. And Jenny is our clinical training manager for Orion. She's responsible for continuous quality improvements, performance management, and behavioral skills training with the Orion coaching department. Jenny has a bachelor's in science from Brigham Young University, specializing in exercise physiology and wellness. So again, these are our experts, our CDC certified diabetes prevention coaches. And ladies, we're talking about sleep today. And I know many of us just went back to school and the transitions are changing. Maybe we're sleep deprived or maybe we're getting a little bit more. So I'm excited to talk about how sleep and diabetes are related. So Jenny, do you want to start and kind of talk to us a little bit about that? Obviously, this is the next iteration of our series. Do you want to let us know how sleep fits into this topic that we've been talking about this year?
Absolutely. And I think it's important to note that it's estimated that 1 in 2 people with type 2 diabetes, so 50% of people diagnosed with type 2 diabetes, have sleep problems due to their unstable blood sugar levels and the accompanying diabetes-related symptoms. So it is very prevalent when you're talking about diabetes to have sleep issues. And there's 2 relationships that you need to be aware of when you're talking about the correlation between sleep and diabetes. The first relationship is how your blood sugar affects sleep. And then the second relationship is how sleep affects your blood sugar. And it sounds like I said the same thing, but they're actually 2 different things. So the first relationship of how does blood sugar affect your sleep? Hyperglycemia, meaning that your blood sugar is too high, and hypoglycemia, meaning that your blood sugar is too low during the night, can lead to insomnia, an actual sleep disorder, as well as next day fatigue. High blood sugar or hyperglycemia results in the kidneys overcompensating. The kidney's job is to help eliminate and remove waste from the body. When you've got so much blood sugar, it's trying to get rid of all of that. And so it causes you to urinate more often, leading to fragmented and disrupted sleep. High blood sugar can also cause headaches, increased thirst, which might also inhibit sleep. And on the inverse side of things, low blood sugar or hypoglycemia can cause nightmares, night sweats, as well as feelings of irritability and confusion when you wake up. And so all of that is just how your blood sugar, your level of blood sugar, is impacting your sleep. And then there's how your sleep impacts your blood sugar. And do you want me to keep going, Megan, or do you want
Yes.
to take over at this point?
I
I
may
feel like I'm
preface with
talking a lot.
no. I was just thinking I may have more questions and answers for you two during this webinar. So yes, please continue, because I was like, oh, how? Go on.
I'm I'm a big fan of sleep, so I'll keep talking about it. So with the relationship of how does sleep affect blood sugar, when you're getting less restorative, slow wave sleep referring to stages like 3 and 4 of sleep, that's your deep sleep. Um, when you're getting less of that restorative slow wave sleep, that has been linked to higher sugar levels. Sleep restriction affects blood sugar levels because its impact on insulin, cortisol, oxidative stress. Sleep deprivation increases your risk of developing insulin resistance. And Megan and I have talked about this a lot, of insulin resistance can exist without being diagnosed with type 2 diabetes. That's kind of like a precursor. And that link between sleep deprivation and developing insulin resistance can be apparent as early as childhood. So for parents, you were talking about kids going back to school, super important making sure that your kids are getting enough sleep as well. And then sleep deprivation also has additional impacts on your hunger hormone. So that's ghrelin. That's the hormone that signals that you're feeling hungry, and it increases that. So you are feeling hungrier. And it also decreases leptin, which is known as the satiety hormone, meaning that you are not feeling as full as you normally would. So you are hungrier and you are less satisfied, meaning that you are going to likely crave and consume more sugar and more carbohydrates because your body is going to be desperate to get more energy and utilize that sugar as energy. And you can go back to our first episode where we're talking about nutrition and learn more about how carbohydrates impact your blood sugar. But I probably went too on along about that, Tara. I apologize. But
no, you are just fine.
Relationships at play here. And then I don't know if we want to get into the conversation of how sleep apnea, which is an actual sleep disorder, impacts diabetes, but we can go there too. But I'll turn it back to you because I've been talking for too long.
Yes, no, you're exactly right. And it's one of those as well, when I think about, the topic that we're talking about. Yes, we're, putting it with diabetes prevention, but at the same time, all of this information that we're talking about is relevant for, over 40 million people that struggle with sleep disorders. So again, if you're zoning in on the diabetes part, know that you can zoom out. And everything that we're talking about is relevant as well, even if you're not going down that path of diabetes prevention, even though we all should. And so, Jenny, one of the other things that I did want to throw in there when we're talking about kind of sleep deprivation and how it affects our brain is, our ability to control some of these things. So that like prefrontal cortex that's telling us, making the right decisions. Mm-hmm. If we're sleep deprived, we're also more likely to choose the high sugar, high fat, all of those different foods that realistically within the diabetes nutrition world, we shouldn't be choosing as well. So again, this realistically probably should have been our very first episode, because without this, so many of the other different dominoes don't really line up. So
I think that's a really good point. Yes, nutrition is such a huge driver in glucose management and diabetes, right? That's always going to be a huge conversation. But your sleep habits, your sleep hygiene, if I can call it that, it does create a foundation for you, like you're saying, Tara, to make different decisions through the day, like you're saying, Jenny, in the hormone management. The hormone management part of it, that was actually really important for me to understand. And if I can go back just a little bit and highlight the cortisol management that sleep helps keep on a regular basis. So I learned that deficient sleep increases those stress hormones, cortisol being a main one. And one of cortisol's function in a flight or fight response is to dump glucose into your bloodstream to fuel that reaction. So your deficient sleep raises the cortisol, which drives glucose into your bloodstream, making the pancreas produce more insulin. It starts this war between insulin and glucose that is just insulin's working harder and harder and harder, and eventually becomes, not even eventually, let me back up, but it becomes less efficient. And another thing that struck me is not eventually, as little as 4 or 5 days of deficient sleep has this impact. And if I'm remembering correctly, if I read correctly, it's somewhere like 20 impacts it at a 25 up to 40% difference. It was huge.
Yeah. It's huge.
It's significant and it's fast.
Yes, so fast.
Yeah, it's amazing. So one of the things, ladies, that I did want to talk about, and we'll keep circling back to hormones, that will definitely be a theme of our chat today for sure. But we're talking a little bit about sleep deprivation and being sleep deprived. Megan, can you define that for people? And what are we talking about there? Is this 2 hours of sleep each night, or is this 6 hours, or does it matter?
5 seems to be the average, the mean. that keeps coming up. So as little as 5 hours. And I imagine a lot of people listening, maybe even us on this panel, think, oh, well, I get 5 hours of sleep on the regular. Yes, exactly. That's why this is so relevant, is because 5 hours of sleep, or around there, 4 to 6 hours of sleep a night, is so prevalent. So is diabetes, metabolic syndrome, many diseases that little sleep would have an impact on.
Jenny, do you have any differing opinion?
I'm a stickler for nuance and nomenclature. So the way that sleep deprivation is used, if you're reading like scientific literature or anything within the research community, sleep deprivation is just basically meaning that you're not getting enough sleep, compared to sleep deficiency is like a broader concept, meaning that it could include sleep deprivation, but it can also include sleeping just like at the wrong time of day, where you're fighting against your circadian rhythms, that you're not sleeping well, or you're not getting all the different types of sleep in your body, because that's really important, being able to go through all of the cycles and stages of sleep, or including sleep disorders that are actually preventing you from getting a night's sleep or causing poor quality to sleep. So that was, just wanted to add that extra little nuance in there. When we're talking about sleep deprivation, that's just not getting enough or the quantity of sleep. There's a whole nother conversation about getting quality sleep as well, which is very impactful.
Yes, I think about, I love saying the word sleep fragmentation. I think so many of us have been in that, where you just get a little chunks of sleep and you just wake up feeling like you didn't sleep at all. So again, that all falls into that quality as well. But I love that word fragmentation.
Yeah, new parents are not going to love that part of our conversation, are they?
Yes, it's all a phase, all a phase.
I was like, don't learn about sleep health when you're a new parent.
Yes, we are not here to solve that problem, for sure.
There's a time for you, and it's not right now. You just do the best you can. You are doing great.
Yes, exactly.
Speaking of the nuance on the amount of sleep that is sufficient, I maybe want to throw out there, on average, 7 to 8 hours is what an adult needs, right? There are those ends, I don't want to say fringes or extremes isn't exactly the right word I'm looking for. There are exceptions to the rule where people who sleep more 5 or 6 hours a night do thrive on that. But again, that's more an exception than a rule. 7 to 8 hours seems to be the more typical recommendation, what a healthy adult needs. I don't imagine there's a lot of teenagers or children on this podcast, but people have teenagers and children who need more.
Yeah. Can I plug in for teenagers really quick? I know that, again, that's not our main demographic, that's in terms of listening, but for parents that are listening, teenagers need 8 to 10 hours of sleep. They need so much sleep. And teenagers are at this place where their circadian rhythms have just shifted. Like, you've got your like up to 12-year-olds that still go to bed fairly early, and then all of a sudden your teenagers are staying up super late. Their circadian rhythm literally just shifted to a later time. They can't go to sleep earlier. If you put them in bed at 8 p.m., they're just going to lay there. So not only are they fighting that because their circadian rhythms have shifted, but they've got the earliest school times too. And so they're getting so little sleep. And the teenage years, your adolescence, is a time where you are growing so much. You're supposed to be learning so much. You're developing all these critical thinking skills. You're supposed to be learning, creating new memories, all the huge developmental stage, and they're being shortchanged by sleep. So as like a plea to parents, let your kids sleep.
Yes, I know, right?
Don't get them up early so they can be productive. They need sleep. They need 8 to 10 hours of sleep. They need more sleep than you. They're not being lazy. They need it. They're listening to their bodies. I apologize. That was a tangent.
Yes, her PSA there. No, but it's so important. We're going to talk more about sleep hygiene, and again, it all falls into that. Do we dare talk about the light deprived society and technology that we have as well? That is not helping any of us, especially the teenagers who, so many are connected at all times. So we'll talk more
Mhm.
about that in a little bit for sure. So ladies, we do have some questions coming in. So I do want to circle back to those, obviously, before we really start to dive into what people can do. One of which, Jenny, someone did say, keep going down that path of diabetes and sleep apnea. So can you give us an abridged version of where you were going to go with that?
Keyword being abridged. I got it.
Oh, sorry.
No, I'm happy to talk more about that though. I love learning about sleep disorders, especially in relationship to diabetes. I think it's important to know, so you might hear it called sleep apnea, obstructive sleep apnea, OSA. Sleep apnea increases insulin resistance, even in non-diabetic and non-overweight people. So that is entirely separate. But when you are diabetic or when you do have insulin resistance, it is exacerbating that. It affects your insulin resistance. It affects your glucose control. It actually causes Tara's favorite word of sleep fragmentation. So what that's doing is that it's interfering with your slow wave sleep or the deep sleep, and it actually will periodically cut off your body's oxygen supply. It'll give you that feeling of like you like are gasping for air because you weren't breathing. And together, all of these effects lead to, again, insulin resistance, impaired glucose metabolism. Good news is that there are treatments for actual sleep apnea, especially the most common being CPAP treatment, which can improve it. So it's not like a life sentence, and it does actually improve your blood sugar and your insulin resistance. I'll make that my abridged version.
Love it. No, I think that's so great. Thank you so much for kind of circling back to that. So back to the conversation outside of the chat. What about sleep hygiene? First of all, Megan, you mentioned this. And when I think hygiene, I think brushing my hair, washing my face, brushing my teeth. Talk to me about hygiene when it comes to sleep.
So, and please correct me if you two think differently. I think of sleep hygiene as my behaviors or one's behaviors around sleep habits. So is there a wind down routine that you do? Does it happen at a consistent time? What's the environment in your room? Am I getting ahead of the conversation?
No, I think you're exactly
Okay.
right.
And
Okay.
environment
I'll pop in
and
as well.
behavior surrounding sleep is how I would define sleep hygiene for sure.
Okay,
Yeah,
great.
exactly. And I think with sleep as well, one of the things that I think about is it's not just right before bed. We really realistically should be preparing for sleep all day long, not just within, the 30 minutes before we go to bed. So again, it's, sleep hygiene, unfortunately, is an all day behavior.
That made me think about it in a different perspective actually when you said all day, because yes, there's suggestions like if you consume caffeine, do it early. Exercise early. Do those things in the morning. If you take a nap, keep it short, do it before mid-afternoon. Yes. I have even had my favorite person on this topic is Ben Bikman. He's written my favorite book on insulin resistance. And where was I going with this? Sleep? Was that the last thing I said? Wow.
Sleep hygiene, Ben Bikman.
Ben Bikman suggests that like a diminishing return on investment with longer naps, and that really about 20, maybe up to 30 minutes is the longest one should be napping, if napping at all, through the day. Again, preferably like late morning, maybe early afternoon. But then as you're getting into the evening, creating a regular wind down routine. And I do think that there's some common things that would happen in this, and also a bit of variety depending on what works for you. Would you say, ladies?
Yeah,
I mean, it's totally unique.
With any behavior change or development, it has to be individualized. Absolutely.
For example, taking a shower or maybe taking a tub, right? Taking a shower is something that wakes me up. I prefer to do that in the morning, whereas maybe taking like a tub is a little bit more relaxing. When you get out of that tub, when you get out of the warm water, it drops your core temperature, which helps induce sleepiness in your body.
Yeah. And I feel like you're getting into some of like the kind of the tips and tools associated with getting a better night's sleep. There, and not to cut you off, because you did a great job with how to plan that throughout your day. One thing that I want to include in terms of how this is an all-day thing is getting outside in natural sunlight for a minimum of 30 minutes a day. And I bring this up specifically. We live in Utah, the three of us, and we are approaching a time of year where a lot of people go to work when it's dark, and when they walk out of work, it is also dark. And it can be really hard for a significant portion of the year to get any sunlight. And so that's something to also consider when we're talking about lights. There, you know, most people think of dimming lights, eliminating blue LED lights from, you know, like TV, cell phones, computers, etc. But get sunshine. Like it's easier now. It'll change your life. Getting around.
Those circadian rhythms are driven by sunlight, right? So the kind of the waves that you get from sunlight in the morning and midday are different from what you would get in the evening, which you also don't want to then artificially simulate with. That's why turn off screens, get electronics out of your room is a regular suggestion.
Getting that sunlight early in the morning before the UV kicks in too is always key. Helps us wake up too. Ladies, tell me about routines. Like I said, we've talked a little bit about, you know, we talked about caffeine, we've talked about sunlight, but what about routines, bedtime routines, or some people call them rituals? Jenny, do you want to dive into that?
There is power in rituals, and there, to me, and people can disagree with me, but the difference between like a routine and a ritual is there's like a level of sacredness almost surrounding a ritual. It's not something that you just do, but it's done with intention, and like a level of like love and care. And rituals can be so impactful and empowering, especially before bed and before sleep. And the ritual that you take, entirely up to you, whatever that needs. Some things that you might want to consider of like how of incorporating some sort of relaxing activity. That might be reading a real book. Sorry to my e-reader fans, but like not using a screen, using a real book, whether that's stretching, listening to music. Any of these things can be part of a bedtime ritual. One thing I'll say is that we live in a day and age where we are so overscheduled that there is no time left to unwind. And I'm totally guilty of this. Just yesterday, I was taking my son to his little introductory to hockey lessons, and we get done at 6:15. We get home at 6:30. We immediately have to like make dinner, eat dinner. And then I'm like, everybody go to bed. I was like, we've got school tomorrow. Hurry up, get your pajamas on, get your teeth brushed, jump in bed. I'll read you a story. Let's go. But so often we live of just like, we've got one thing after another. We are so overbooked. We are so overscheduled that we're just trying to go. And then all of a sudden we get in bed and we can't fall asleep because we have not engaged in that retiring to bed ritual that actually helps relax our body, calm our mind, soothe ourselves, and get into that framework where it's a lot easier to fall asleep.
Yes, I mean, it goes back to the beginnings of time when people were counting sheep. As silly as that sounds, you know, there is something very, very calming about counting, whether it's up or down. So counting sheep actually is rooted back to kind of this ritualistic thinking. It's almost a meditative practice. Jenny, I'm surprised you didn't bring up meditation and mindfulness, but I'll help. And one of the educators that I learned from, his sleep hygiene was similar to counting sheep, but he knew exactly how many stairs and steps it took for him to get from wherever he was to his bed. And so that was his ritual, is actually counting down the number of steps that it took between, point A and B of him putting his head onto the pillow. So I thought that was very interesting, as that counting sheep, ritual kind of rolled back there.
I find the counting down really interesting, and I have this in my mind as a call to action, is the counting down, but it makes sense that it also is a call to like stop and stop and sleep and sleep.
Yeah.
So I've always thought of the counting down of a 5, 4, 3, 2, 1, stand up out of bed, start my day. I also can see counting, from the bottom of my steps, how many you have, 10, 9, 8, to my bed, is also this practice of, I know what I'm doing. Like Jenny mentioned earlier, there's an intention behind that ritual. So that countdown at this time of day gets my mind into this mode of, oh, I know what's happening next. We're getting ready for bed, start to shut down.
Exactly. And Jenny, you brought up, kind of that ritual of finding peace, when you're going to bed. So we have to bring up the sleep environment, which we kind of touched on briefly. But again, the sleep environment is so, so, so helpful. What do you suggest there?
Sorry, was that directed towards me? I'm happy
yes,
to.
Yeah. Just,
What's
the ideal sleep environment? What should we do?
So there's a few different things. Temperature is really important. Ideally, your room should be dark, cool. Temperature wise, this is a lot cooler than some people would normally think. But research shows that it's most effective around like 65 degrees. Your environment should also be gadget free. I know that as I said that, someone was listening and said, but I need my phone for an alarm. No, you don't. There's an amazing thing called alarm clocks. You don't actually need your phone next to you. Make it gadget free. And your bedroom should be comfortable. It should be inviting. It should invite relaxation. Invest, you're spending a third of your life asleep. Invest in a good mattress, invest in good pillows and linens and whatever you need. But it should, just dark, cool, peaceful, gadgetless. If you have a TV, get rid of it. Your cell phone doesn't belong there. Your laptop doesn't belong there. And with that, so once you've got your room there, you also want to keep, just thinking about the bed. Your bed is for bed activities, which means sleeping and sexual intimacy only. You're not reading in bed. You don't want to answer emails in bed. You don't want to work in bed. That's not the time for everything that you've got going on. Get in a chair, get somewhere else. You can train yourself to fall asleep just by limiting bed for bed activities. And something that, since you called me out on this last time, something that can help with that is some deep breathing, some meditation, some progressive muscle relaxation, even sleep hypnosis. 5 to 10 minutes. I know some people think of I don't have time for this. Honestly, 5 to 10 minutes. And it will drastically impact your ability to fall asleep.
Yes. Go to bed 5 to 10 minutes early so you can do those things.
Yeah.
I think if you're going to be laying in bed wide awake anyway, is that not your time to meditate? And the time spent either way.
Yeah. And if that's something that's overwhelming, not only did I create a couple of podcasts where you can listen to my soothing voice over and over again, but there's free resources, not just with our podcast, but if you're a Spotify listener, there's free guided meditation recordings. There's free sleep hypnosis recordings that are incredibly effective and that would require the use of your phone. So I realize that I'm just saying that you shouldn't have your phone in there, but I would be willing to make an exception if that's the only thing it's used for.
You
Mhm.
also said don't let it overwhelm you, right? One step at a time. If all of these things are not happening, start with figuring out how to make your room darker. Start with
Mhm.
lowering the thermostat. If you are using a guided meditation or a sleep app on your phone, find one that is running while the screen is off, right?
Mhm.
Um,
Mhm.
we use actual sound machines, especially for my daughters. But if we're not at our home and it's time for them to sleep, I find a YouTube that is a like sound on black screen
Yeah, white
YouTube.
noise.
White
Mhm.
noise. Yeah,
Mhm.
thank you. White noise. Um,
Yep.
but the also we recognize that if it feels overwhelming to make all these changes at once, that's not actually going to help improve your sleep hygiene.
Mhm. Yep, exactly. And, something that I'm thinking about, and a comment just came in about, you know, the disruption in the routine or the disruption in that ritual. It's okay to be disrupted, but know that you may have to start over. Sometimes I'll do this as well. And I've had, different, educational opportunities where people get disrupted in the middle of the night and they actually start their routine all over again at 2 o'clock in the morning
Mm.
because they know that it's still going to help them kind of descend into the sleep even if they wake up in the middle of the night. It's okay to kind of redo some of these things if you fall into that sleep fragmentation that I'm talking about. It's just to kind of start all over, and it's okay. And it's telling your body it's okay to do this again.
Yeah, absolutely. You're training yourself.
I would
Mm-hmm.
suggest it's like exercise, right? And if you're just getting into a running routine, you're not
Yep.
starting at marathon miles and pace. It's
Mm-hmm.
a buildup of these routines and training your body to do better and better over time.
Exactly. Ladies, I do want to circle back really quick. I do want to mention exercise really quick as well. This is also something, obviously we're talking about our sleep routine and things that we're doing at nighttime, but obviously exercise, circling back to our last, podcast episode, this is so important when it comes to sleep as well, to make sure that we're getting some sort of exercise. But for whoever wants to answer it, there's a little bit of the method to the madness when it comes to exercise and sleep, of when we should do this. So, any suggestions on that?
I'll let our personal trainer answer that.
The
Megan, when should I exercise to go to sleep?
in the morning is
Mm-hmm.
is the most effective time. Um, for most people, again, I know there's exceptions. Some people can exercise late at night, go home and crash. I had a basketball game last night at 8:15 and didn't fall asleep until midnight, whereas most other nights I'm out by 10. Um, so earlier in the morning or earlier in the day, excuse me, um, is going to spike those energy levels when you need them to be spiked to energize your day. It helps reduce stress, speaking of cortisol. It helps reduce stress. It helps with blood flow and oxygen to your brain as well as the rest of your body, which can help with mental clarity as well. So you're more energized, you're more focused for your day. And then as the day goes on and you continue to expend that energy, now there's like an appropriate energy expenditure in the evening
Mm-hmm.
to what do I want to say, aid in that winding your body down for bed.
Yep, exactly. You don't want to wind up, you want to wind down for
Hmm.
sure. And I know I sleep better if I exercise during the day. If I get no activity, I'm dead.
Can I add 2 cents? I
Mm-hmm.
always have 2 cents to add. I'm not waiting for permission. Um, because Megan and I as coaches are so big on how do these behaviors realistically work within your life. So what I don't want is someone to hear early exercise is the only exercise.
Only option.
If I can't
Hmm.
do it early, then I might as well not do it. That is not what we said.
Hmm.
In regards to sleep, though, if you are going to do evening or later exercise, ideally, if you can make that 2 to 3 hours before your designated sleep schedule bedtime, that is part of your ritual, that will that will help a lot with being able to fall asleep. If you are trying to exercise and then immediately fall asleep, you are going to have an energy level spike and it is going to be really difficult. So that is not to say that you can't exercise in the evening. Please exercise. It has so many benefits, not just related to insulin resistance. But if you can do it 2 to 3 hours before you're going to bed, that will have a big impact on you.
And
Yep.
I may add in there, consider the type of exercise that you're doing. If you're
Yes.
going out for a walk, that can be relaxing versus getting out and running hills, doing some
Yes,
sprints.
or
Yeah, the intensity
stretching,
of an
some
exercise
light
matters.
yoga.
Yoga. Yes, there's many
Yep.
different ways to be active. So maybe consider the type of activity depending on the time of day it is. Can also
And the
help.
intensity of it.
Yes.
All right, since we're talking about diabetes, of course, I'm going to circle back to nutrition as kind of our closing conversation. We do have a question that came in about kind of monitoring and controlling the blood sugars, someone who's already diabetic. And again, if we can't answer this today, that's fine. We'll circle back. But again, what we should be eating in order to control, some of those glucose levels as we sleep, because they will decrease and increase. So do either of you have an answer to that?
I feel I have two answers depending on the individual. Maybe one who is diagnosed diabetic versus someone who isn't,
Right.
because of what you just said, the consideration of needing to control diabetes, right? In an individual who is not diabetic, my first thought was actually lighter meals, kind of the same time frame as the exercise, actually 2.5, more 3-ish hours before you're ready to go to bed. And that reduces the likelihood that your body's trying to digest food through the night, which
Right.
would interrupt that sleep. But if you are diabetic, can we answer that today, Jenny? My next thought was pairing macronutrients so there's a slower release of glucose into the bloodstream.
You totally, I was like, I don't know if you want to come to me, because my answer is probably going to be the one that this person doesn't necessarily want. And that's going to be, just talk to your doctor and your whoever's in charge of your diabetes management plan. Specifically with sleep, and when you're diagnosed with diabetes, at least 50% of, I believe it's 50% of diabetics experience something called the dawn phenomenon, which is a really common cause of high blood sugar levels in the morning for people with diabetes. And it's due to several things, but like there's a natural increase in certain hormones in like the early morning hours. The treatment for that will vary depending on your existing diabetes management plan. So there are options. I don't feel super comfortable recommending them, because it would depend on if this is your experience or not, where your hormones are with this, what kind of plan you're already on with diabetes, what medication you're taking, what time you're taking those medications. So my recommendation would be talking to your provider that is in charge of the diabetes care management plan, which I know is not the answer that you wanted.
Yes, no, I think it's great. And that's actually a great lead into kind of my last question, is where people should turn for help. Obviously, we're just barely touching the surface of this. I have one resource that I would love to throw out there and just introduce as, one of kind of my Bibles for sleep. It's called Why We Sleep. For those that are viewing the screen, I don't know. Uh-oh, now I'm blurred. Uh-oh, can't even see it. Anyways, it's called Why We Sleep by Dr. Matthew Walker. He is an amazing educator and physician, all surrounding sleep. So this is a great resource for me that I have loved. And he is on a million podcasts, and he's so fun to listen to. He's just a normal guy, but he has such real life experience and so many research studies to back it up. It's fantastic. So that's a resource that I would love to suggest. But Jenny and Megan, what are some other resources if people are still looking for more help and they're looking for more information?
There are a lot of different sources of help. There's a lot of I mean, I think we've talked a lot about how blood sugar impacts sleep, sleep impacts blood sugar. If you're just talking about sleep, where you're like, I just need help with sleep, there are a lot of people that you can turn to for help. You can turn to coaches like Megan and I. We would be happy to help you with sleep hygiene. We can help you with your environment. We can help you with your sleep behaviors or your behaviors that are surrounding sleep. You can see a sleep medicine specialist. If you are concerned that you have an actual sleep disorder, they are going to be the ones that help you with your diagnosis and your treatment plan. A therapist can be tremendously impactful. Poor sleep is maybe the number one symptom of or manifestation of trauma, of a trauma response. And that all of the baths, the timing, the lack of light, like, you know, all of those things that we've talked about is not going to help when you need trauma supported therapy. Therapist is going to help that, especially with trauma response, if that's what's happening. And then also including your doctor and everything. Poor sleep can be a symptom of, you know, just within your larger scope or picture of your health. You always want to include that information. And also, you almost always need a doctor's referral to see a sleep specialist if you're working within the insurance industry. A lot of them won't cover it unless you do have that doctor's referral. So that might be a first step. One group of people that isn't necessarily isolated to a profession, if that makes sense, are CBTI practitioners. That stands for Cognitive Behavioral Therapy for Insomnia. Doctors, counselors, therapists, psychiatrists, there's lots of different coaches. There's different practitioners that are experienced with CBTI. You can find those through professional organizations like the Society of Behavioral Sleep Medicine and the American Board of Sleep Medicine. CBTI should be like the number one first line effectiveness, especially if you've got sleep orders. It's for insomnia, specifically for sleep disorder of insomnia. Basically what that is that during treatment, this trained CBTI provider will help you identify your thoughts, your feelings, your behaviors that are contributing to the symptoms of insomnia. And then those thoughts and feelings are examined. They're tested to see if they're accurate. While behaviors that we were talking about are also examined to determine if they're promoting sleep. So that provider will help clarify, reframe misconceptions and challenges in a way that is conducive to just getting a more restful sleep. So often as a coach, I hear someone say to me of just like, I can't make my mind stop. Like I've got a lot of anxiety, like I just can't stop. CBTI is a fantastic approach and method for you. The American College of Physicians really does recommend this as like the first line. In a lot of patients, it's even more effective than medications. We didn't talk about sleeping pills or any medications as interventions, but CBTI is natural, will benefit your natural sleep cycles and is often more effective. And especially if you're in a group of people who are a little bit more higher risk of experiencing insomnia, like pregnant people, people who have a trauma response, like with PTSD, people experiencing insomnia after cancer treatment, those really high risk for insomnia groups, extremely effective for those groups.
100%. I love it. And so much of it is, you know, what our health coaches do, but in a very, you know, pinpointed method. So that's a fantastic suggestion. Megan, do you want to offer anything else up in terms of where people should look?
No, I don't know that I should take away from the wonderful recommendations that were just given. My Myrna and echo chamber, depending on where you are, the needs that you have around your sleep, that can be as simple as, you know, knowledge is power. Read some literature, listen to some podcasts, increase your education on the subject, and apply that to your behaviors. To working with a health coach like Jenny and I, where we can ask some questions, kind of dig into those habits and those behaviors, and come up with a plan up to diagnosable sleep conditions like insomnia. There is quite a range, right? So I'm just an echo of beautiful recommendations. Consider what your personal needs are.
Yes, absolutely. I'll post in the show notes as well some of our very favorite sleep hygiene tools that our health coaches use as well that Jenny shared with me. So I'll post that in the show notes for the podcast as well if people need some immediate answers and things to try. But Megan, Jenny, I appreciate your expertise. Like I said, we just barely touched the surface. There's so much more we could do. But we will be kind of transitioning a little bit between now and our next episode, but I'm sure we're going to talk about sleep again when we talk about kind of stress management tools and how that can help with diabetes prevention as well. So we'll be doing that in the fourth quarter as well as we continue and kind of close out our series about diabetes prevention. So thank you to you expert ladies. Fun conversation. We're receiving a lot of great feedback already about it.
Thank you, Tara and Jenny. Speaking of experts, thank you.
Thanks for having us as always, Tara.
Thanks. Have a great day. Thanks so much.
Bye-bye.